Hello and welcome to today's episode of Focus Atlanta. I am your host, Keisha Anslin. Thanks so much for tuning in with us this Sunday morning. In this week's episode, we'll get tips about preparing for the SATs. We'll learn about the Letters to America campaign. We'll chat about Google Trends. And March is National Social Workers Month, and social workers are on the front line of nearly every major crisis. I'm here with Dr. Anthony Eastreet.
Hello, Keisha. How are you? So nice to be here.
Oh, thank you so much for your time. Can you start at the beginning, kind of like tell us a little bit about the role social workers are taking right now?
Social workers are taking on a lot of roles from healthcare all the way up to policy and advocacy. Many of the things that you're seeing happening today in your community are being impacted by social workers. So everything from going to therapy or school-based mental health, all the way to the policy and advocacy that you see in terms of what the laws that govern us. Like we have our hand in all of that, and really trying to make sure that communities are really faring well in this current environment.
Can you speak a little to the shortage of healthcare workers right now?
Yeah, so we're currently in a what we call a mental health workforce shortage, and what that means is that as the need for mental health increases, we don't have enough providers that are keeping up with the demand, and so we saw that coming out of COVID, where more people during that isolation period certainly found that the things that they were once able to control, isolation certainly highlighted that, right? So anxiety, depression, stress, because I know myself when COVID happened, becoming a stay-at-home parent and teacher, because I had to make sure my kids were still doing everything, created a whole lot of stress and anxiety. And so people have been reaching out more around mental health and also just the increase around talking about it, right? There used to be a stigma around mental health, and now we are talking more about it on social media, in the news, everywhere. And so people are now normalizing the conversation around mental health. So it's creating an increase in demand, which is great, but it also means that we also have to make sure we keep up with how we're bringing people into the pipeline to be able to address that.
Is there anything that we should know about the trends in anxiety and in suicidal ideation? Again, you mentioned how many people struggled coming, into the pandemic and coming out of it. Can
Mhm.
we talk a little about that?
Yeah, I would say one. I think first starting off, if you're experiencing mental health conditions, please always know that there is 988 to be able to call to address any mental health crisis that you're having. At the same time, we are seeing increases in suicidal ideation, suicidal behavior, especially among younger Black youth, right? And I think that needs to be talked about for the first time. And this data came out a couple years ago. For the first time, Black youth were outpacing their white counterparts in terms of suicide and suicidal ideations. And so that means that our youth are crying out more for mental health services and ways to be able to address that. So as we think about school social work, right, we also have to think about it from a prevention kind of standpoint. The earlier we can address and talk about mental health as a prevention, the more that we have youth that are able to express and talk about their mental health concerns, and really thinking about, as people progress, those youth then become adults who are able to talk about their mental health and concerns.
As we talk about the shortage of healthcare workers in this nation, what would you say to someone who is in this space, working in this space? How can we push forward? How can we, do what we need to do without wearing out the people who are working in this industry?
Yeah, I would say definitely focus on self-care. As we are out here working with the community, we're also living in the same communities that we're working in, right? So self-care becomes a thing, right? So find those healthy outlets that you find joy, right? I think joy is resistance. I think joy is a way that we can also deal with our ongoing mental health, right? So make sure you're making connections. I think one of the things that we also talk about is sometimes having those genuine conversations with people about what's going on with you and asking them, how are you really doing, and engaging that conversation can decrease the symptoms that we're feeling in real time. At the same time, I think that we also have to look at the systems aspect, right? Some of our systems are overworking some of our healthcare providers, right? And we have to come up with sensible policies and really legislation that helps to support the workforce while they're continuing to do this. That means, higher pay, PTO, and what that looks like. I think it's really around creating a healthier workforce and supporting that workforce to continue to be able to do this work.
Thank you so much for making time for us here on Focus Atlanta. It was a pleasure to meet you.
It was a pleasure to meet you too as well.
All right, I can't say it any better than that, Dr. Eastreet. Joy is resistance. I'm going to write that.
Yes.
I'm going to put that on a sticky on my mirror.
Joy is resistance. Joy is resistance. And I try to, highlight that for as much people because, everybody, just in the climate, like it just feels like so much is happening. I'm like, yes, and we can still find those moments of joy throughout our day to be able to keep doing it.
Thank you so much. All right, guys, I can't say it any better than that. Thank you so much for tuning into this segment of Focus Atlanta. Please stay tuned for more.